Hello, wonderful people. It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my cancers or oncology playlist. In previous videos, we have talked about lung cancer, pancreatic cancer, nasopharyngeal cancer, kidney cancer, cardiac tumors, and much more. Today, we shall talk about colon cancer, mainly 20 clinical features or signs and symptoms of colon cancer. The word cancer is synonymous with a malignant tumor. Here we're not just referring to colon cancer, but to colorectal cancer, because the cancer can appear in the colon as well as the rectum. Click the like button, click the subscribe button, and let's get started. This video is part of my cancer playlist. We've talked about leukemias, lymphomas, multiple myeloma, neuroblastoma, nephroblastoma, and much more. What does the word ology mean? It means the study of, and onco means cancer. Quick anatomy review. After the pharynx, we have the esophagus. After the esophagus, there is the stomach, and then the duodenum. What does the word duodenum mean? It means 12. 12 what? Is it 12 centimeters, 12 inches, 12 feet, or what? If you know the answer to this question, please comment below. After the duodenum, we have the jejunum, then the ileum. Together, we can call them the jejunoileum. Then I have the cecum, followed by ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anal canal. The opening of the anal canal is called the anus. The word colon is synonymous with large intestine. What does the word cecum mean? It means cul-de-sac. It means I'm open at one direction, but the opposite direction is blind-ended like this. Blind-ended equals cecum. Then ascending colon, transverse colon, descending colon, sigmoid colon, rectum, anus. Why do we call the sigmoid colon sigmoid colon? Because it looks like a sigma. It is an S-shaped structure, as you see. Ready for some math tricks? Okie dokie, let's draw my quadrants. And let me give you a beautiful sigmoid function. Now look at this. Doesn't that look like an S? Sigmoid function, sigmoid colon, meaning S-shaped, or like the Greek sigma. Sigmoid, sigma-like. What does the word carcinoid mean? Cancer-like. How about android? Man-like, i.e. robot. Does anyone remember the oxygen hemoglobin dissociation curve? It looked like this. Oh, like an S shape. Yeah, sigmoid. But please do not confuse sigmoid with sinusoid. Sinusoid, or the sine wave, looks like this. Because the word sine means pocket. Here is a pocket, here is a pocket, 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 pocket. And here's a question for you. If I see a sine wave on EKG, what does that mean? What does that signify? Please comment below. What else is sigmoid in the body? How about the sigmoid dural venous sinus in your brain? It also looks like an S. See, medicine and mathematics make perfect sense once you understand what the French toast you're talking about. Colon cancer is today's topic, but what is cancer? Well, there are many types of cellular growth. If the cell is growing in size, it's called hypertrophy. Growing in number, it's called hyperplasia. If I'm changing the tissue from one type to another type in the same category, for example, one type of epithelium to another type of epithelium, or one type of connective tissue to another type of connective tissue, this is called metaplasia. If I have defective, dysfunctional growth, we call this dysplasia, dysfunctional growth. But metaplasia means change in growth. Hyperplasia means more growth. And what is neoplasia? New growth. Something new is growing that did not exist before. And cancer belongs to this category. If plasia means growth, then what does the word aplasia mean? It means no growth. Are all neoplasias cancers? No. Neoplasias could be benign or could be malignant. So, the word neoplasia is synonymous with the word tumor, which is synonymous with any word that ends in oma, except Oklahoma. These tumors could be benign tumors, no big deal, or malignant tumors, Big freaking deal. If you want to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. Define neoplasia, please, or new growth. It's an abnormal mass of tissue. Why should I care? Because the growth of this tissue exceeds the normal growth, is uncoordinated with that of the normal surrounding tissue, and this abnormal tissue will persist even after the cessation of the stimulus that caused the growth in the first place. Example, suppose that I smoked cigarettes for years and years and years, decades and decades and decades, heavy smoker. Then I developed lung cancer. Even if I stop smoking now, the lung cancer is not gonna disappear. And that's why cancer is evil. So, tumors or neoplasias or any word that ends in "oma" could be benign or malignant. The malignant tumors are also known as cancers. These cancers could be cancers made of epithelial tissue, we call them carcinoma, or cancers made of connective tissue, we call them sarcoma. Today's topic is colorectal cancer. The most common type of colon cancer is a carcinoma, hands down. Why? Because your colon has many glands like this. Glands is epithelium. These are glandular epithelia. Glandular epithelia, therefore, adenocarcinoma. Adeno means gland, carcinoma means cancer made of epithelial cells. When carcinomas metastasize and leave their place and go somewhere else, they usually metastasize to lymph first. But when sarcomas metastasize, they prefer to go to the blood first. And that's why a good doctor who suspects cancer should examine the lymph nodes and should order tumor markers in the blood. If the cancer spreads to the lymph node, we can remove the lymph node via surgery or radiation. If the cancer spreads to the blood, we'll try to kill those cancer cells by giving chemotherapy. More cancer facts. It's a growth with no control, growth with no limit. There is no evident cause. That's why we talk about risk factors of cancer and not causes of cancer. So anyone who says red meat causes colon cancer, no, red meat is a risk factor for colon cancer. What the flip is the difference? Correlation is not the same as causation. Let's suppose hypothetically that the level of cancers in patients living in apartments was lower than the cancer rates in patients living in houses. Does that mean that houses caused the cancer? Not necessarily. It could be many other factors. Correlation is not the same as causation. Cancer can arise from any type of cells. Some cancers serve no function whatsoever. Other cancers secrete some stuff, and we call this a paraneoplastic syndrome. Para means parallel, neoplasia means tumor. So it is a syndrome that happens parallel to tumors, with tumors. For example, some types of lung cancer secrete hormones like ACTH or ADH. So when I have a cancer that secretes something or is associated with another feature, we call this a paraneoplastic syndrome. Please do not confuse cancer, which is a malignant tumor, with carcinoid, which is not a cancer at all. It just means cancer-like. It resembles cancer because it too is a mass, but it's not necessarily malignant. And this is my favorite slide, the poop emoji. Normal stool should look like this. It should be brown. Why is it brown? Stercobilin or urobilin. Where did I get urobilin from? From urobilinogen. Where did that come from? From bilirubin. And where did that come from? From the liver. And where did the liver get the bilirubin from? From the blood. And how did the bilirubin form in the blood? From biliverdin. And where did the biliverdin come from? From hemoglobin, which came from your red blood cells. So normally stool should be brown. But what if my stool is bright red like this? Oh, if it's bright red, it means there is probably bleeding in the lower GI tract. A classic example here will be hemorrhoids or piles. So when I say lower GI, what does that mean? Well, here is stomach, duodenum, jejunum, ileum, and then the colon. Amazing. You see the duodenum? The last part is attached to something called the ligaments of Treats. Before it, proximal to it, is called upper GI. Distal to it is called lower GI. Of course, if I have hemorrhoids, there will be in that anorectal area, which is of course lower GI bleed. That's why it is bright red, because this blood is fresh. The injury is downstairs. After I injured myself downstairs, you see that blood in the stool, so it's gonna be bright. But what if the bleeding is coming from upstairs? Let's say that I have an ulcer in my stomach. Well, ulcer in the stomach reminds me of hydrochloric acid. Blood from the ulcer will be poured into the acid, forming hematine. Hematine has a black color, and therefore if I have an upper GI bleed, as in peptic ulcer disease, my stool will be black and tarry like this, and this is called melena. So bright red blood is lower GI. Black tarry stool is upper GI. But what if it's in between? What if it's kind of dark red-ish? Well, it could be coming from anywhere. It could be upper GI, it could be lower GI, etc. And that's when you go fishing. What do you mean? I mean you scope me upstairs, called endoscopy, or esophagogastroduodenoscopy, and you scope me from downstairs, called sigmoidoscopy or colonoscopy, to rule out upper GI bleed and lower GI bleed respectively. Okay, here is another topic. What if my stool is fatty and greasy and yellowish in color and foul smelling and floats on the surface of the water in the toilet bowl? This is steatorrhea. That's lots of fat in the stool. It could be caused by a problem in the liver or bile, a problem in the pancreas, or a problem in the small intestine. Because whether I have a problem in the liver, bile, pancreas, or small bowel, the end result is inability to absorb the fat. So I get what? Malabsorption syndrome and steatorrhea. What if my stool is clay color like this, very pale, light gray? Oh, this is obstructive jaundice, such as having a stone obstructing my common bile duct, or having cancer in the head of the pancreas. Risk factors for colorectal cancer: genetic mutations such as APC mutation, KRAS mutation, and DCC mutation, or mismatch repair defect. Normally, I should be able to repair any mismatch in the DNA, but some patients have defect in DNA mismatch repair. So I cannot repair the mismatch, therefore mutations, therefore cancer. Other risk factors. Most cancers in general are more common in males, except breast cancer, thyroid cancer, cancer related to the liver/bile because of estrogen, and cancers of the female reproductive tract. Other than that, any other cancer is more common in males. Bone cancer, males. Leukemias, males. Lymphomas, males. Colorectal cancer, males. Anal cancer, males. Brain tumors, males, etc., etc. Family history. If colorectal cancer runs in my family, it makes me at high risk of developing colorectal cancer. Tobacco smoking, low fiber intake, and increased consumption of red meat, animal fat, increased caloric intake, being obese, or having inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. Medicosis. Does increased fiber intake prevent colorectal cancer? Well, fiber is good for you. However, according to Harrison's Internal Medicine, quote, contrary to prior beliefs, the results of randomized trials and case-controlled trials have failed to show any value for dietary fiber or diets high in fruits and vegetables in preventing the recurrence of colorectal adenoma or in the development of colorectal cancer. Unquote. In other words, saying that fiber is good for you and fiber prevents colorectal cancer are two separate statements. This is the ascending colon or right colon, but this one is the descending colon or left colon. Normally, which one is larger in lumen? Well, the ascending colon is way wider than the descending colon, and hence the famous adage, left side obstructs, right side bleeds. Or lowered, left obstructs, right bleeds. Why does left obstruct? Because it's already narrow. If I start a tumor here in an already narrow descending colon, well, I can obstruct it. And when I obstruct it, when I form an annulus around it, I will look like this, like a napkin ring, a napkin passing through a ring, which can lead to obstruction of the colon. But if the cancer is in the right colon or ascending colon, it is wide open as you see, so it's more likely to bleed. It can rarely obstruct. And of course, this bleeding will end up being pushed by bowel movement into the stool. Quick question, if I have blood in the stool and it's bright red, does that mean that it has to be colorectal cancer? No, it could be hemorrhoids, it could be polyps, it could be angiodysplasia, or it could be diverticulosis, among others. And of course, it could be cancer. One of the classic signs of cancer of the gastrointestinal tract or alimentary canal, whether I have stomach cancer, liver cancer, pancreatic cancer, or colon cancer, is something called Leser-Trélat sign. What is this? It is sudden, dramatic, explosive eruption of multiple lesions that resemble seborrheic keratoses. But not just one seborrheic keratosis, but many. What is a seborrheic keratosis? Well, think of it as a stuck-on lesion, brown like this. But not just one, here we have many. When they erupt suddenly like this, now that is scary for sure, and it could be a sign of an underlying cancer. It doesn't have to be colon cancer, could be colon cancer, pancreatic cancer, liver cancer, stomach cancer, lung cancer, breast cancer, or a cancer in the urinary tract. And this is a classic example of a paraneoplastic syndrome. What is the neoplasia? It could be the colon cancer. What is parallel to it? The skin lesion that you see here. Now, I've promised you to tell you about 20 signs and symptoms of colon cancer. Let's go. Blood in the stool. Are you talking about black tarry stool, or are you talking about bright red, usually bright red? Bright red blood coating the surface of the stool. Well, I don't care. Why is this important? Because the cancer is in the colon, which means the entire GI tract was healthy until I reached the colon. So I was able to make some stool, and the stool was consistent, and we started to get bigger and bigger and bigger. Okay, and then what? And then I hit the area that had the cancer. Then, after being formed like this as a stool piece, I got coated with blood later in my descent through the alimentary canal. And that's why you will see the blood on the outer surface of the stool. What else? Well, let's think of a colon. All right, here is a colon like this, and it has a tumor. Now, what do you think is going to happen to the remaining lumen or cavity of the colon? It got narrower, of course. And when it gets narrower, the stool will be forced to become narrower like this, as thin as a pencil, called pencil-thin stool or changed stool caliber. Abdominal pain, and when the doctor presses on your belly, tenderness, it hurts. Abdominal distension, constipation, or diarrhea. Tenesmus, which means I constantly feel that I need to pass stool despite an empty colon, or a feeling of incomplete defecation. Inability or difficulty to empty the bowel at defecation. Sometimes the cancer can cause obstruction, which will lead to obstipation and constipation. What's the difference? Constipation is, let's say, instead of having one bowel movement a day, I have one bowel movement every 4 days. That is constipation. But failure to pass stool and gas is obstipation. Palpable mass could be felt in the abdomen, anywhere in the abdomen, on the colon if the cancer is still in the colon, or it could go somewhere else. It can go to the liver, and I can feel a mass in the liver. It can metastasize to the uterus, mass on the uterus, mass in the rectum on rectal exam. Any cancer can lead to what? Weight loss. A patient who pays close attention to his or her bowel movement and bowel habits can detect the occurrence or recurrence of colorectal cancer before any doctor can. And it might help a lot to keep a diary. Anorexia, I do not want to eat at all. Cachexia, I'm becoming super thin. Malaise, I'm always tired and pale. Why? Anemia. Why? Because I'm bleeding. I get iron-deficiency anemia. SOB, which literally stands for shorts of breath, because I'm a good guy, I do not curse. Dizziness, exercise intolerance. Why? All of these are symptoms of anemia. Enlarged liver. Why? Maybe the colon cancer has metastasized to the liver. Or uterine mass. Could be because my colon cancer metastasized to the uterus. and this can mimic a fibroid. The explosive eruption of pigmented skin lesions, laser trila sign. Acanthosis nigricans, dark velvety, thickened skin on the back of my neck and my armpits. It is associated with diabetes, polycystic ovary syndrome, and some visceral cancers like colon cancer and gastric cancer. Skin tags can even happen with colon cancer. And there you have it, 21 signs and symptoms of colorectal cancer. If you want another video to discuss the diagnosis and management options for colorectal cancer, please comment below. You can learn about the genetic forms of colorectal cancer, such as familial adenomatous polyposis and hereditary non-polyposis colorectal cancer. I have discussed both of them in separate videos. And speaking of heredity and cancer, I have a separate video titled Hereditary Breast Ovarian Cancer Syndromes. If you want to learn more about colon cancer, hepatocellular carcinoma, renal cell carcinoma, urothelial carcinoma, and much more, download my surgery high yields course at medicosisperfectionalis.com. To learn about breast cancer, uterine cancer, ovarian cancer, cervical cancer, vaginal cancer, vulvar cancer, and much more, download my obstetrics and gynecology high yields course at medicosisperfectionalis.com. My courses come equipped with videos, notes, and cases. To learn more about chemotherapy, download my anti-cancer pharmacology course. And if you want to practice with some cases, try TrueLearn QBank. You can choose the difficulty of your questions on a scale from 1 to 10, 1 being the easiest and 10 the hardest. TrueLearn has questions for pathology, pharmacology, microbiology, immunology, biochemistry, biostatistics, psychiatry, anatomy, embryology, neuroanatomy, all the branches of internal medicine including gastroenterology, cardiology, rheumatology, nephrology, neurology, as well as surgery, pediatrics, and much more. Click on the link in the description, use promo code MEDICOSIS to get a special discount, and you can even try TrueLearn for free. There are more than 300 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, and Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.